Good morning, everyone. I hope everyone remembered to fall back on their clocks this weekend and had an enjoyable Halloween. Over the past several days, we've continued to see an uptick in COVID-19 cases. Morgan County saw an increase of 232 cases from Friday to this morning. November is here, and the holidays are right upon us. This year might look a little different to protect those we love, but it will be no less special. Today, we're very fortunate to have two special guests with us. To my right, we have Kelly Powers, President of Decatur Morgan Hospital. Kelly, thank you for joining us again.
Thank you.
And then to my left, for our first time, we're thankful to have with us Alabama Department of Public Health Assistant Administrator for the Northern District, Michael Glenn. Michael, it's a joy to have you with us today.
Thank you, sir. Thank you.
Yes, sir. So just a few updates. Current Morgan County COVID-19 cases are at 4,370, which is an 8.62 weekly increase. As of today, we remain a high-risk county on the state of Alabama Department of Public Health risk dashboard. Halloween just wrapped up and Thanksgiving is upon us. Now's the time to begin thinking about how you can create a safe holiday plan for you and your loved ones. COVID-19 testing that we had scheduled for last week has been rescheduled for this week. Please note that the scheduled COVID testing from last week will now be, do we have a date? No date. So we're just waiting to hear a date. Just remember, you won't have to exhibit symptoms to be tested. Feel free to go once we have a date. Also encourage you to call someone in your neighborhood. As always, this seems to be a real good practice, and we especially encourage that with our elderly neighbors. So with that, Kelly, you have an update for us?
I do, yes. Currently at Decatur Morgan, we have 27 positive inpatients. That's down from 39. We were up, Mayor, a week or so ago at 39, but we're at 27. And then we have 5 presumptives that we haven't received the test results yet. We have 8 ICU patients, which is up, and 5 on the ventilator. Just wanted to let everybody know I did go and look at some reasons. My children always ask me, Mom, why are so many deaths? Well, hypertension or high blood pressure is the number one comorbidity or risk factor with the deaths that we've seen from the Journal of American Medical Association. And how many of us have high blood pressure? I know I do. So I'm at risk. So even though I'm not considered elderly yet, I am at risk for, having a bad case of COVID-19. That's why I think people need to take this seriously. Other issues are diabetes and all heart conditions. So it's not just people that have asthma. Of course, that's a big one, but just keep in mind that there are a lot of health conditions that we need to be concerned about and continue to wear our mask, social distance, wash our hands, and as the mayor said, come up with a safe plan ahead of time to take this seriously. So we are seeing an increase in our community, which usually it takes us about 7 to 14 days for those patients to be admitted to the hospital. So we're looking at more admissions with that. One other thing I wanted to let everybody know, we are moving along with the new COVID unit at Parkway. We had 5 or 6 employees this morning in new employee orientation at the hospital, so really excited to see them and getting everything ready to hopefully open that in the next few weeks.
Thank you, Kelly.
Thank you.
Thank you. Michael,
All
good
right.
to have you with us.
Good to be here. Thank you, Mayor, for allowing us to come and give an update of what's going on statewide and in our county as well. I want to give you some quick numbers this morning, kind of give you a lay of the landscape of what we're looking at right now. Statewide, we have 194,892 total COVID-related cases at this point in time, with 2,973 total deaths. In Morgan County, more locally in our neighborhoods, what's going on, we have 4,567 total cases countywide with 36 deaths, and that's 1 death increase over this time last week, and we mourn for that loss and for that family as well. Over the last 14 days, we've had 617 confirmed cases in our county, which doesn't sound like a lot overall, but if you get into the numbers, that's about 13.5% of the total number of cases that we've had this whole year, and so that's a great uptick. And the total number of people that have been tested, a little over 26% of those are coming back positive. So we have a high rate of community transmission at this moment in time, and so we've got to be diligent about doing the things that we know, that we've talked about ad nauseum to do to fight this. There's 967 people statewide that are in the hospital with this as well, and as Kelly talked about this morning, Decatur Morgan is busy. Thankfully, it's on the downward trend. I hope it stays that way, and we continue to do those kind of things as well. I have 12 counties in the Northern District. 10 of those counties are either very high or at a high risk of community transmission right now. And so it's not just Morgan County, it's not just Decatur, it's all of North Alabama at this point in time has a high rate of community transmission. So we got to be diligent to use the tools that we have available for us. So what are those tools? Those same three things that we've been talking ad nauseum about over the last few months. Maintaining social distancing of at least 6 feet with those that are outside of your household. Good hand hygiene, soap and water for at least 20 seconds if you have that available. If you don't, then hand sanitizer, and then mask wearing. That's a big deal right now with people either don't want to do it or don't do it correctly. It needs to cover your nose and your mouth to be effective, and so those three things we need to do. Those tools are not 100% effective, but those are the tools that we have available to us at this point in time. As I drove up this morning from the office, I thought about the risk that we undertake each day as we go out and do our normal activities. When I was driving here this morning, I thought about the risk it is just to get out in the car in the traffic. I wore my seatbelt. I drove at the speed limit that was posted. I maintained a safe distance in front with the car in front of me. I didn't check emails on the way up here. I didn't do any checking of text on the way up here. All of those things combined together help me get here safely today. And if we'll do the three things that we've talked about week after week after week, we will reduce the spread of transmission of this virus in our community. Thankfully, the treatments are getting better. The death rate is going down. Hopefully, in the very near future, we will have a vaccine that has been approved. There are a number of companies that are diligently working on this to make sure that it's both safe and effective. And when that's available, that'll be another tool in our toolbox that we'll be able to use. And so we'll use all these things together to get through this. And so just want us to focus on some positive stuff as well. The good news of this is, yes, this is a very dangerous virus. It's a very, nobody wants to be sick. But overall, of all age groups, 98.9% in Alabama right now are recovering from this virus, of all age groups. If you are like what Kelly talked about this morning, if you don't have a comorbid risk factor and you're under 65 years old, it's way above 99% that you're going to recover. But with that being said, nobody wants to be sick, and we do mourn for those over almost 3,000 people in our communities that have died, and those people that are on vents this morning and in the ICU. So we all need to do our part to reduce the spread. And Mayor, I'll just close with this. Tomorrow is a big day. We're going to be out voting tomorrow. So with that being said, just be cautious. But what I want us to do is, most of all, there's going to be a huge line. There's going to be a huge turnout tomorrow. So just be patient as you wait for your turn to do that. And most of all, be kind to the people around you. And we'll get through this all together. And so, Mayor, if there's nothing else, I'll turn it back over to you.
Thank you.
Thank you,
Thank you very much for the report. While we wait in line, we still want to practice the distancing.
Absolutely.
The 6-foot spacing.
Absolutely.
My wife and I just had the pleasure of going on vacation, and we went, of all places, we went to Florida, where masking is not required. But I was very encouraged to see that most of the folks that we came across, they had a mask on. And most businesses required you to have a mask on before you enter. So even though it's not a state mandate, they were still practicing those things. So just encourage our residents to really press hard. I know you're probably fatigued, tired of this, but we just got to follow the guidelines to make sure that we're able to keep our community open, our economy, and the things that we want and to live. So with that, our next press conference will be Monday, November the 9th at 10 o'clock. We will be on air via YouTube tonight at 6 o'clock as we have our organizational meeting where we have 5 council members that will take the oath of office, and then I'm honored to be able to do the same. as we get ready to start this new administration for the city of Decatur. With that, we'll see you next Monday. Thank you.